If you understand how these three blood pressure medicines actually behave inside your body, the whole experience becomes less frightening. You stop second-guessing every symptom. You stop blaming your age, your diet, or yourself, and you start asking the kind of questions that actually protect you. That matters because millions of seniors take Amlodipine, Losartan, or Lisinopril every single morning for years and never learn the fingerprint of the tablet in their hand. Then one day the ankles swell, or a strange dry cough shows up out of nowhere, or the monitor flashes a number that feels alarming, and suddenly a stable routine feels like a crisis. Today I want to make this simple. I am Dr. William Lee, and we are going to walk through these three very common blood pressure medicines together. What each one truly does, what side effects deserve your attention, what quiet mistakes cause big problems, and one overlooked situation, especially during illness, hot weather, or even a skipped meal, that can turn a safe medicine into a risky one overnight. Most people are never given a clear plan for that exact moment. Stay with me because this single detail changes how you use all three medicines more safely for the rest of your life. But first, one important boundary. Nothing in this video is a suggestion to stop your tablets on your own. That can be dangerous. The goal here is understanding, not fear, not rebellion, just understanding. Because when you understand the pattern, you notice trouble earlier. And when trouble is noticed early, your doctor can adjust things before a small issue becomes a bigger one. Now, all three of these medicines lower blood pressure, but they do not do it the same way. And that is exactly why their side effects feel so different from each other. Think of your circulation like the plumbing in your home. You have a pump, you have pipes, you have pressure signals, and you have backup controls. One medicine relaxes the pipe walls, another interrupts a hormone message before it forms. A third one blocks that same message at the receiving end. Same destination, three very different roads. And when the road changes, the body gives different feedback. That is the entire key to today's video. Let us begin with amlodipine. Amlodipine belongs to a group of medicines called calcium channel blockers. In plain English, it helps the blood vessels relax. When the vessel wall softens, blood flows with less resistance, and less resistance means lower pressure. Quietly, smoothly, and often very effectively. That is why amlodipine is so widely prescribed, especially for older adults whose arteries have naturally become stiffer with time. Many seniors do very well on it for years. But here's the detail almost nobody explains properly. Amlodipine has a very recognizable side effect pattern, and you have to know where to look. Watch the feet, watch the ankles, watch the lower legs. Not with panic, with observation. The shoes may feel tighter by late afternoon, the socks may leave deeper marks by evening. The skin around the ankle may look puffy after dinner, and many people jump straight to the worst conclusion. They think, my heart must be failing, or they stop the tablet in the morning without telling anyone. Slow down. With amlodipine, that ankle swelling usually happens because of pressure shifts inside the tiny blood vessels of the legs. Fluid can move more easily out into the surrounding tissue, so the ankle looks fuller, even when the heart itself is doing just fine. That does not mean you ignore the swelling. It means you report it accurately. When did it start? Is it in both legs equally? Is it worse at night? Does it improve by morning? That timeline matters because sometimes the answer is a smaller dose. Sometimes the answer is pairing it with another medicine. Sometimes the answer is switching to a different option entirely. But that decision belongs in a medical conversation, not in a frightened guess at 6 a.m. Now, an important distinction. If the swelling comes with chest pressure, severe shortness of breath, sudden weight gain, or if one leg becomes much larger than the other, that is different, and that needs prompt attention. But in most cases, simple evening ankle puffiness on amlodipine is the medicine's fingerprint, nothing more, and recognizing that can spare you weeks of unnecessary worry. If you take amlodipine and you have noticed swelling, tell me in the comments what confused you first. Was it the shoes? Was it the socks? Or was it looking down at dinner and realizing your ankles had disappeared? A lot of people watching will recognize themselves in that moment. Now let us move to lisinopril. Lisinopril works very differently. It belongs to a group called ACE inhibitors. That stands for angiotensin-converting enzyme inhibitors. Yes, that is a mouthful, so let me translate it. Your body has a hormone system that quietly controls vessel tension, salt balance, and blood pressure in the background. Lisinopril turns down one part of that system. When that signal gets weaker, the blood vessels do not tighten as strongly and pressure comes down. In the right patient, lisinopril often does more than just lower a number. It may reduce strain on the heart, and in some people, especially those with diabetes, It may help protect the kidneys over the long term, so this is not just a random tablet. It often carries a bigger job. But lisinopril has one side effect that patients remember for life: a dry cough, not a chesty cough, not thick mucus, not the cough of a winter flu. I mean a dry, tickly, repetitive cough that hangs around for no obvious reason. Sometimes it starts within days. Sometimes it appears weeks or even months later, and that is exactly what makes it tricky. A person begins the medicine, feels fine, forgets all about it, and then when the cough shows up, nobody links the two together. They blame pollen, they blame dust, they blame the fan, they blame acid reflux, they blame the change of season, and sometimes it really is one of those things, but very often the tablet is the missing clue. If you started lisinopril and later developed a new dry cough, mention it clearly. Do not just say, "I guess I catch coughs easily now." Say when it began. Say whether it wakes you at night. Say whether it feels dry rather than chesty. That helps your doctor decide whether lisinopril is the likely cause. And now I have to shift tone for a moment because there is a rare but serious reaction with lisinopril you must know about. It is called angioedema. That means sudden swelling of the lips, tongue, face, or throat. This is not mild ankle puffiness. This is different. This is swelling that can interfere with breathing or swallowing. If your lips suddenly enlarge, if your tongue feels thick, if your voice changes, or if breathing becomes harder, you need immediate medical help. Do not wait for a routine appointment. Do not sit at home hoping it settles. This reaction is uncommon, let me be very clear about that, but because it can become serious quickly, you must recognize it. That is not panic. That is preparedness. Notice the larger lesson here. Side effects are not proof that you are weak. They are not proof that your treatment has failed. They are the body's way of sending useful information. The safest patients are not the ones who stay silent. The safest patients are the ones who notice patterns and speak up early. If you ever had that mysterious dry cough on lisinopril, tell me in the comments. Did anyone connect the dots for you, or did you figure it out on your own after weeks of confusion? Your story might be the one that helps another viewer finally understand what has been happening to them. Now let us talk about Losartan. Losartan also works on that same hormone system, but at a different step. It belongs to a group called ARBs, angiotensin receptor blockers. Here is the easy way to picture it. With lisinopril, the message is reduced before it can even form properly. With Losartan, the message still travels, but the receiving lock is blocked. The signal knocks on the door, but the door will not open. The result is the same. Blood vessels do not tighten as strongly, and pressure comes down. That is exactly why many patients are switched from lisinopril to Losartan when the cough becomes unbearable. Same general mission, very different side effect pattern. And Losartan has its own warning sign that almost nobody warns you about: potassium. Losartan can raise potassium levels in your blood. That matters because potassium controls the electrical rhythm of the heart. Too little is a problem, too much is also a problem. Now here's where good intentions quietly create trouble. A senior hears the advice, cut down on salt. So they buy a salt substitute. Or they add an electrolyte powder someone recommended. Or they start using a low-sodium seasoning blend. Or their grandson brings home a sports drink. And many of those products are packed with potassium, sometimes a surprising amount. So the person believes they are making healthier choices. But behind the scenes, the chemistry is shifting in the wrong direction. If you take Losartan, read the labels. Read the back of the salt substitute. Read the tub of the hydration powder. Read the electrolyte sachet. Look for the word potassium. Look for phrases like electrolyte blend, mineral support, or low-sodium alternative. Because sometimes the risk is not the medicine. It is the medicine plus the well-meaning extra sitting on your kitchen counter. And this becomes especially important if you have kidney disease, diabetes, or reduced kidney function, because in those cases, the margin for error is smaller. If your doctor orders blood tests every few months, please do not treat them like optional paperwork. Those tests are part of the treatment. They tell us whether the chemistry behind the scenes is staying safe. I hear these lines all the time. I only use the salt substitute a little bit. I only take the electrolyte drink after gardening. I only use it during the summer. That may sound minor, but repeated habits matter more than one large event. A little every day, quietly, for months adds up. So here is one sentence to bring to your next appointment. Ask, is there anything in my kitchen or my supplement drawer that could raise my potassium on this medicine? That single question can prevent a surprising amount of trouble. Now let me zoom out for a moment. 3 medicines, 3 fingerprints. Amlodipine often points us toward ankle swelling. Lisinopril often points us toward a dry cough, and rarely toward dangerous swelling of the lips or tongue. Losartan often points us toward potassium awareness and regular lab follow-up. Same destination, 3 different roads. And if you treat all 3 like identical tablets, you miss the most important clues your body is trying to send. Now let me give you something even more practical. Many older adults create anxiety for themselves by monitoring their blood pressure the wrong way. One reading is not the full truth. Blood pressure changes with stress, sleep, pain, temperature, a rushed morning, a full bladder, or an upsetting phone call. If you measure right after climbing stairs, or while you are annoyed with someone, or with your feet dangling off the chair, the number can mislead you badly. A pattern matters far more than a single snapshot. Measure at the same times each day. Sit quietly for 5 minutes first. Support your back. Rest your arm at heart level. Do not talk during the reading. Do not argue during the reading either. And please do not check 5 times in a row because the first number scared you. That almost always creates more tension, not better information. A written log is stronger than memory. Morning reading, evening reading, symptoms, sleep, illness, medicine changes. That kind of record tells a story your doctor can actually work with. And if you have ever taken your pressure after rushing around the house and scared yourself for no real reason, tell me honestly in the comments. You will not be alone. Many sensible people turn a rushed reading into an unnecessary panic. Now let us talk about something that matters more than most people realize: dizziness. Not because dizziness itself is dramatic, but because dizziness leads to falls. And for a senior, one fall can change everything. When a blood pressure medicine starts working, or when a dose changes, some people feel lightheaded when they stand up, especially first thing in the morning, especially after a hot shower, especially after a missed meal or a light lunch. The room may shift for a second, vision may dim, the knees may feel uncertain. That is your signal to slow down. Swing your legs out first, sit on the edge of the bed, take one breath, then another, then stand. I know that sounds almost too simple, but simple habits prevent broken hips, broken confidence, and hospital stays. A pressure tablet lowers pressure. Gravity still does its job, and when the body is not caught up yet, standing too quickly exposes that gap. If dizziness keeps happening, worsens, or ever leads to fainting, that needs a real conversation with your doctor. Do not accept repeated dizziness as a normal part of aging. Very often there is a reason, and very often it can be adjusted. Now we come to the detail I asked you to stay for. This is the mistake that quietly causes trouble with all 3 of these medicines. Seniors treat sick days like normal days. That is the trap. You come down with vomiting, or diarrhea, or fever, or you lose your appetite, or you sweat heavily in the heat and barely drink water. But the tablet routine continues, unchanged, without any thought about the fact that the body has changed dramatically overnight. That is where real risk begins. During dehydration, all 3 of these medicines behave differently. Blood pressure may drop far more than expected. Dizziness may become severe. Weakness may set in. And in some people, kidney function can quietly worsen in the background without any obvious warning. This is one of the most important ideas in this entire video. The safety of a medicine is not just about the name on the box. It is about the name on the box plus the condition of the body on that particular day. Amlodipine in a well-hydrated senior is one story. Losartan during a stomach bug is a very different story. Lisinopril during a heat wave with poor drinking is yet another story. So every person taking a blood pressure medicine should ask their doctor for a sick day plan. Not a vague idea, a written plan. Ask this exact question: if I am vomiting, have diarrhea, cannot keep fluids down, or become dehydrated, what should I do with these tablets? Then write the answer down. Keep it next to the tablets. Save it in your phone. Tell your spouse, tell your children. Because when you feel sick, thinking becomes slower, and that is the worst possible time to try to invent a strategy. And here's the second hidden trap. Over-the-counter pain relievers, especially the anti-inflammatory ones like ibuprofen, naproxen, and diclofenac. Used regularly, these can strain the kidneys, particularly when they are combined with blood pressure medicines. Now add dehydration, or hot weather, or poor appetite, and that combination can turn into a real problem. This is one of those quiet patterns that catches even careful people off guard. A blood pressure tablet in the morning, ibuprofen for the back in the afternoon, very little water throughout the day, then weakness, then worse kidney numbers on the next blood test, then confusion about how it all happened. Not because anyone was reckless, because nobody connected the pieces. If you need pain relief regularly, ask whether your current pain medicine is safe with your blood pressure tablets. Ask before it becomes a daily habit, especially if you are older. Especially if you already have any kidney issues, especially if you take more than one blood pressure medicine. Listen, many older men in particular pride themselves on pushing through. They do not want to bother the doctor. They keep the same tablets going, add a pain reliever, sweat through the heat, eat very little, drink even less, and they call that toughness. It is not toughness, it is an avoidable risk. Here's the real message I want to leave you with. For a large number of seniors, everything I said earlier can fall apart if the context is ignored. The right medicine used in the wrong body state can behave like a completely different medicine, not because the tablet changed, but because the situation around it changed. People focus obsessively on the name on the box: Amlodipine, Losartan, Lisinopril. But the smarter question is this: what is happening in my body today? Am I swollen? Am I coughing? Am I dizzy when I stand? Am I dehydrated? Am I using a salt substitute I never mentioned? Am I taking ibuprofen most afternoons? That is how safer patients think. That is how calmer patients think. One more practical layer before we finish. Do not hide symptoms because you think they sound too small to mention. Many patients report the big things but skip the useful things. They forget to say, "My shoes felt tighter this week." They forget to say, "The cough started after the pharmacy switched my brand." They forget to say, "I nearly fell getting out of bed on Tuesday." They forget to say, "I started using a new salt substitute last month." Those details are not random. They are exactly what allows a doctor to adjust treatment properly. If you are the type of person who keeps everything in your head, please change that habit. Write it down. A small notebook beats memory every time, especially when several medicines are involved. Date, symptom, reading, new supplement, illness, pain reliever use. Simple, but consistent. And when you walk into your next appointment with real notes, the conversation becomes sharper immediately. No guessing, no vague recall, no wasted minutes. Just useful information that leads to better decisions. If this breakdown has helped so far, please press the like button so more seniors can find it. That small action truly does help spread practical health education to the people who need it most. And if you want more videos like this one, subscribe. Because next I want to do a full guide on when a blood pressure reading truly matters and when it simply reflects stress, poor timing, or bad technique. Now let me close the loop clearly. The most common mistake that quietly undermines blood pressure treatment is not one mysterious food. It is not one dramatic side effect. It is using the same routine during sickness, dehydration, heavy heat, or regular pain reliever use without a clear plan. That is the piece almost everyone misses. And once you understand that, you stop reacting blindly. You start noticing patterns sooner. You bring better questions to your doctor, and your treatment becomes more stable, more personal, and honestly, far less exhausting. So here's the main message. Swollen ankles on amlodipine are a signal. A dry cough on lisinopril is a signal. Swelling of the lips or tongue on lisinopril is an emergency signal. Potassium questions on losartan are a signal. Dizziness when you stand is a signal. Feeling worse during illness while still taking the same tablets is a signal. Kidney stress from regular anti-inflammatory pain medicines is a signal. These are not burdens to carry alone. These are conversations to have with your doctor this week. Look at your medicine list tonight. Look at your supplements. Look at your salt substitute if you use one. Look at the pain relievers in your drawer and ask yourself one honest question. Do I actually know the fingerprint of the tablet I take every morning? If the answer is no, that is perfectly fine. Start now. Write down your readings the right way. Write down your symptoms. Ask for a sick day plan at your next visit. Bring specific questions instead of vague worries. And if you have taken one of these 3 medicines, tell me in the comments which one and what pattern you noticed first. Was it the swelling, the cough, the dizziness, the fatigue, or maybe nothing at all? Sharing that kind of experience helps another viewer somewhere realize their body has been telling them something all along. Because in the end, better blood pressure care is not about panic. It is about pattern recognition. It is about using the medicine with respect, not fear. It is about protecting your kidneys, your balance, your confidence, and your quality of life. Not by guessing, not by suddenly stopping tablets, but by understanding the system one signal at a time. This is Dr. William Lee reminding you that the more clearly you understand your medicine, the more peacefully you can live with it.